Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. In this presentation, we're going to look at how ChatGPT can help us with medical emergencies. So I'm going to put the ChatGPT to test drive and see what kind of answers it gives for various kinds of medical emergencies, and see if it helps people with very limited medical knowledge who are not in the medical field. So I have put in a series of questions here. I'm just going to walk you through. And I say, medical emergencies, can ChatGPT provide guidance? And this is what the ChatGPT said. This is an artificial language model. It provides you with information, knowledge, and you need to seek professional help. It cannot give you specific recommendations or treatments. That's fair enough. So let's talk about a person is having a heart attack symptoms. What is the response? And here we get a nice beautiful response of what are the heart attack symptoms, like chest pain, discomfort, shortness of breath, sweating, nausea, vomiting, irregular heartbeats, dizziness. One of the important things about chat is it is text based. It scans through 170 billion sources of information and combines them into a composite readable text. It is not image based, it is not graphical, and it is not audio. So basically it is text at this time. But still, nonetheless, it provided some useful information. But the important thing I would say is you need to rephrase the same question in different ways so that you get different answers. I just put heart attack or cardiac arrest. Most people don't know the difference between heart attack and a cardiac arrest. So here it says, heart attack occurs when a blood flow to the heart is blocked, usually by a plaque buildup. Whereas cardiac arrest, on the other hand, is when the heart suddenly stops, either has no heartbeat whatsoever or has like a ventricular fibrillation. That is called cardiac arrest. People with heart attack can have cardiac arrest or ventricular fibrillation or asystole, as it is called. So it is giving a differentiation between a heart attack and a cardiac arrest. But that's not good enough. Somebody is having a heart attack. What do I do? And here are the recommendations. They say, if you suspect someone is having a heart attack, call 911. Ask them to take an aspirin. Sit or lie down and wait for the ambulance to arrive. Watch for symptoms: breathing, respirations, pulse, oxygen, color, and it's important to make sure you keep track of all their medical problems on hand. Okay, now let's move on to a different medical emergency. What if a grandma is unconscious? What am I going to do? Here it is. Call 911. Check her airway and breathing and pulse. These are basic life support measures, which is exceedingly useful because in an emergency, you don't know. You're not a doctor. You're not a medical professional. Even medical doctors, sometimes we freeze. And it's important to use this information and just follow some of the guidance. You see, call 911. That means the first thing, you have cell phone, put it on speakerphone and dial 911. While you're doing that, you check for the pulse, you check for the respirations, you check for breathing, and look at the color of the patient. If the person is warm or still breathing, and then if the person is unconscious, you look for any injuries because the person fell down, and then the recommendation is to wait for the medical people to come. But if you know if this person is not breathing and if there's no pulse, you need to start the CPR. Okay, what if grandpa may be having a stroke? What do I do? And here are the recommendations. If you suspect your grandpa is having a stroke, call 911 and check his responsiveness speaking, and check the facial asymmetry, the drooping of one side of the face, or ask the grandpa to raise both hands and legs and see if there is a weakness on one side of the body. Check for speech. Is there a slurred speech? See, these are very important for everybody, medical and non-medical people, to keep track of these, and it helps us to know what is going on. Then you wait for the medical emergency. Now here's another important thing. A lot of people have swimming pools, a lot of people go to the beach, a lot of people go to the lake. Sometimes kids slip and get drowned. What do you do in an emergency like this? Of course, you can have a cell phone to look for emergency recommendations, but it's better to have them beforehand, like you're watching this video, and make sure you share this with other people, because this could be a life-saving knowledge. So you call 911, remove the child from the water. It is exceedingly important to get the child from the water away and put them on a flat surface, clear their airways. If the child is not breathing, we need to, and there's no pulse, start CPR. The basic life support principle is no pulse, no respirations, chest compression, start CPR, 30 to 2, 30 compressions and 2 breaths. Remember that for the rest of your life. Then you check their pulse and wait for the ambulance. If there's a drowning victim and if they're vomiting, you turn them on the side and try to help them get the vomiting out so that they're not going to aspirate. So these are all very important information. This is about knowledge. It is not telling you how to doctor yourself or how to treat yourself. But in an emergency, when you don't have any other help, this is a great source of information for knowledge. A kid may have swallowed poison. What am I going to do? The bottle is empty. Here it is. Call emergency service. Poison control, 1-800-222-1222 in the United States. Do not try to make the child vomit unless instructed by the medical instructors. Child is check for breathing, because if they took some medications that suppresses respiration, you check for their breathing. Check for their pulse, because there are some heart medications which can slow the heart rate too much, and if a child has taken that by accident, it could be slowing their heart rate too much. So check for pulse, respirations, color. Color tells you a whole lot about how the circulation is in the body. Let's calm down. Yeah, but what if somebody is having a panic attack? What are you going to do? Here are some recommendations. Remain calm. Reassure the person that the area is safe. Encourage the person to focus on the breathing. Take a deep breath in, hold it for 10 seconds. Breathe out. See, these are all very valuable information that is useful in an emergency situation when you don't have any other source of information that can help you. Google search is not going to give you all this knowledge in a concise manner, tailor-made to your specific question. That's what I like about ChatGPT, I should say. If a person is unconscious and unable to move and burns and injuries, do not remove any clothing that may be stuck to the skin. So these are very important things. And this is about if a person has been a subject of electrical shock. You notice somebody was playing with their plugs, they get an electrical shock. What do? You need to separate that person from the electrical source, but don't try to do it with your hand, because you're going to get the shock along with the other person. So you need to use like a wooden stick to pull their arm or any other object that is connected to the electrical system, and then check for pulse, checks for respirations, checks for color. And these are all basic things which are very nicely explained here. If someone doesn't have a pulse or a respiration, CPR, chest compressions and breathing. So I think in a nutshell, it provides some basic knowledge about what to expect in patients with a heart attack, in patients who are drowned, or in patients who have been having a stroke, or patients having a poison, or a person having an electrical shock. So I would say, you try to explore using ChatGPT in a variety of situations and see what kind of recommendations or knowledge that you can acquire, which will be very useful in case of an emergency. Thank you so much for watching this presentation. I have created several other videos on ChatGPT in asking a simple medical question and compare that with the Google search. I also have created a video on how this ChatGPT could be useful in creating essays or articles for students and for YouTube creators, where you can create your entire text using ChatGPT and have that read by a robot, and then put some images from Google Images, and you have your YouTube creation just using ChatGPT and a voice and Google Images. Thank you so much for watching, and please do subscribe to our YouTube channel. I will see you in the next video.